my talk today is on the utility of Lipiflow in the treatment of ocular surface disease. So as most of you probably know, chronic ocular surface disease is one of the most common abnormalities that we see in ophthalmic practice. It has been estimated that about $3.8 billion are spent on dry eye symptom relief annually in the United States alone. It's been found that MEIBOMIAN gland dysfunction is actually the leading cause of dry eye and not what most people previously thought was due to aqueous deficiency. MEIBOMIAN gland dysfunction results in abnormality of the lipid tear film layer and causes an evaporative dry eye. It's commonly characterized by terminal duct obstruction and/or qualitative and quantitative changes in glandular secretion. So here are just a couple of pictures you can see the normal gland structure here, kind of the whole length of the lid that has been everted. You can see here, you see gland shortening, loss of glands, and mild disease, as well as more significant gland loss in the bottom two pictures. So what are risk factors for dry eye and MEIBOMIAN gland dysfunction? Just simply being a contact lens wearer, having certain systemic conditions, any autoimmune diseases, for example, Sjogren's, rheumatoid arthritis, lupus, postmenopausal women, androgen deficiency, and rosacea. There are also a broad number of medications that can cause dry eye: antihistamines, retinoids, glaucoma medications, and many antidepressants. One of the newer things that people are looking at these days is screen time. We're seeing younger patients that are coming in with dry eye symptoms. You have a lot more screen time, and patients aren't blinking as much while they're looking at these screens. So what do we do for dry eye? First off, we usually start with lubrication. We have prescription medications like Dr. Gannon talked about. We have Xiidra, we have Restasis, and these things usually aim to reduce inflammation. We can try punctal plugs. These block the outflow of the tears that will keep them on the surface longer. Then you have to try to convince the patients to do eyelid scrubs. This can be kind of tedious. They have to do these things every day. It has to become part of their hygiene, almost like brushing their teeth, as well as warm and hot compresses that are heating the lids from the front surface. Omega-3 oils, they also suppress systemic inflammation that can contribute to dry eyes. So what do you do when you have patients on everything pretty much that we have to offer and they still have severe dry eye symptoms? So we looked at LIPIVIEW and Lipiflow. LIPIVIEW is the diagnostic portion. It measures the lipid layer thickness, evaluates their blink dynamics, and images the MEIBOMIAN gland structure. It's a non-invasive office exam and helps answer the question of whether or not a gland is actually secreting. So here's just a picture that kind of shows what you see on the LIPIVIEW machine. It's actually a video, and it shows this lipid tear film layer here as the patient blinks. So we can also look and see how the patient is blinking. Is it a complete blink? Do they have partial blinks? How many times in a minute is the patient blinking? So Lipiflow is the treatment portion. It's a single-use sterile device. It's the only electronic FDA-cleared treatment for MEIBOMIAN gland dysfunction. The single treatment lasts about 12 minutes. It is a maximum therapeutic temperature of about 43 degrees Celsius. It's a precise application of heat to the inside of the eyelid. So as opposed to just placing warm compresses on top of the lid, this is actually getting the heat to the inside of the eyelid where the MEIBOMIAN gland is. It will also massage the outside of the eyelid, so that combination of heat and pressure removes gland obstruction and stagnant content. Here's just another picture of the actual device of the Lipiflow. And here I have a short little video that kind of shows the schematic for those of you who may not have seen how this works before.
And a 12-minute pressure profile to remove blockages in the MEIBOMIAN glands. By heating the glands from the inside, blockages are liquefied. Gentle pressure is applied from outside the lid from the base of the gland to the gland opening, removing blockage and flushing dead cells from the gland. The Lipiflow activator insulates on its inner surface and vaults the cornea to protect it from heat. Therapeutic heat of 42.5 degrees is accurately controlled and directed outward, away from the cornea to the lids. The device never lets the cornea exceed a safe 39.5 degrees. Unlike chemical heat packs that have been shown to overheat. Also, unlike manual lid massage. Lipiflow safely applies pressure to the lids, not to the cornea or the globe.
So the purpose of our study was to evaluate the effect of Lipiflow on chronic ocular surface disease patients. We did a retrospective chart review of 39 patients who had the diagnosis of keratoconjunctivitis sicca and who had had the Lipiflow procedure. 2 patients were excluded due to being lost to follow-up. They never followed up after having the procedure. And 10 patients we excluded just because they had had the procedure within kind of a 3 to 4 week window, and we didn't know that kind of 6 to 8 week initial follow-up data. The things that we looked at were the patient's subjective improvements. Did they have any objective exam findings that showed improvement? Their lipid layer thickness and tear lab data, as well as speed data, which is a questionnaire for dry eye patients. So what did we find? When we looked at the objective exam findings, these are the signs that are seen on exam. We were looking for increased quantity or quality of meibomian gland secretions. Were they more liquid? Were they less cloudy? And any improvement in staining with fluorescein and lissamine green. And what we found was that 18 out of 51 eyes were noted to have an improvement, about 35% of patients. Then we looked at the lipid layer thickness. So this is what's measured and recorded by the LIPIVIEW machine. It's obtained prior to the procedure and then again at a 6 to 8 week post-op follow-up. And in a total of 51 eyes, 17 eyes had a lower lipid layer thickness, 5 eyes had approximately stable, 14 eyes improved, so about 27% of patients after one treatment with the Lipiflow had an improved lipid layer thickness. And there were 15 eyes where we couldn't find the follow-up data. So a speed score, what is it? This is the standard patient evaluation of eye dryness. It's a questionnaire that you give the patient on their initial visit, as well as once they've had the Lipiflow procedure. It asks them the types of symptoms that they experience: foreign body sensation, burning, blurry vision, the frequency of these symptoms, and how severe they are, how tolerable the symptoms are. We found that just based on the speed score, 27 eyes had an improvement, 5 eyes worsened, 17 eyes there was no follow-up data, maybe they didn't have an initial speed score or a post-op speed score, and 2 eyes were stable. So next we looked at subjective improvement. These are the patients and the symptoms that they're complaining of. We based this on what we found in the history of present illness in the chart at that initial follow-up visit 6 to 8 weeks after the procedure. And 39 of 51 eyes noted an improvement. So about 76% of patients at least felt like the Lipiflow machine had helped their symptoms. If you look at those 39 patients, 19 of those had a subjective improvement while also noticing that the LLT values were stable or worse. So even though their lipid layer thickness was technically worse or certainly not improved, they felt better. 12 of 39 eyes noted subjective improvement and LLT values actually improved, so those two things went together. 18 of 39 eyes had objective exam improvement, and 24 out of those 39 subjective improvements also had speed score improvement. So kind of what did we learn from doing this? Well, we see that the objective data can be variable. We do feel like the subjective improvement is more promising. You can see that 76% of patients felt like the Lipiflow procedure actually helped their dry eye symptoms. Lipiflow alone is not enough. This is not something that we think you should treat your dry eye patients with and not also have them on all the other things there is to offer. These patients are going to need to continue to do artificial tears and lid scrubs and probably Restasis or Xiidra, but this can be something that we can add to those patients who are doing all those other things already and maybe still have pretty complicated symptoms. The other thing we found is that LIPIVIEW, where we can show the patients their actual meibomian gland loss, is very important in educating people. Sometimes it's hard to get these people on board to realize that this is going to be lifelong complications and that they're going to need to do these things on a daily basis, just like brushing their teeth. So it's also been helpful to be able to show them their glands.